Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Boost your health today with Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Experience this dynamic duo now. Available on Shopee, Lazada, and our website www.simplynature.asia and our office here in BGC. Grab yours today!
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar, and then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We're always with you from start to healing!
Good day everyone, I am Beth, and today kasama ko po si Ma'am Mabs to tell her cancer journey. So, hello ma'am, good day po. Kamusta po kayo ma'am?
Okay naman, ngayon okay ako, malakas.
So ma'am, can you tell me something po kung sino po ang isang Mabs?
Ako po si Ma'am. Nanayanos po ako ng cancer noong November 2023. Ang simula talaga ng aking nararamdaman noon ay sa ipin lang. And then, ayun, nakita na may cyst na, may bukol na ako sa gum. Pagkatapos, required naman ako for MRI. Lumabas sa aking result na mayroon nga daw akong osteosarcoma. And then, na-confirm nung myopia ko na ito ay adenoid cystic carcinoma. Which is, rare daw yun, sabi nila. May possibility siya na umakyat sa pataas at kumalat pa sa pababa ang liig. Nag-undergo ako ng operation, which is tinanggal yung kalahati ng nalagal ako. Kaya ganito ako magsalita.
Paano po ninyo na-meet or nakilala si Dr. Jansen and yung Simply Nature PPARS? Kilala ko po si Dr. Jansen at na-meet ko po yung Simply PPARS. Dahil po nanonood ako sa Facebook, nung nag-tape na ako ng Simply PPARS, talagang malakas po katawan ko. Simulan sa po, hindi ako hinipon, hindi ako nilagnat. As in, malakas ako. Talagang maraming na-amaze sa akin. Pumayat ako sa treatment ko, pero nakikita nila na malakas ako. Kaya pati yung mga team na radiology, ang sabi sa akin na maganda daw yung malat ko, hindi daw nasunog. Dahil yun sa Simply PPARS. Kasi yun katuwang ko, ako'y nagpapa-radiation. Sa umaga, radiation ako. And then sa gabi, nagtitik ako ng PPARS. Dati, ang required sa akin ay chemo at radiation. Pero nung nakita na on ko na nag-stay lang yung at walang kumalat kahit sa parte na katawan ko, radiation na lang, na-required sa akin. Ayun, papasalamat talaga ako. At nakilala ko yung Simply PPARS at si Dr. Jansen. Malaking tulong talaga. Parang hindi ako nagpapalon. Kilos ako ng kilos, ako ang naglilinis, ako ang nagluluto, at namamalinti pa ako mag-isa. Pero kilos pa rin ako ng kilos, parang bigla akong maisip na, may uuupin ako na, may ganito ako, gano'n. Dati kasi may osteoarthritis na alam ako. Pero mula nung nag-test din ako, nawala lahat yung nararamdaman ko. Malakas ako at maganda yung tulong ko. Talagang, pahagising mo sa umaga, wala ka nararamdaman na, masakit yung ganito ko, ganyan, di ba yung kapag nagkakailan na tayo, masakit yung tuhod, masakit. Ako asin wala parang fresh, parang bumata ang pakiramdam ko. At marami nagsabi, mas naging blooming lang ako ngayon. Dahil yan sa pagsisin ko na Simply PPARS. Ako po, si Ma'am, nanayagnos ako na adenoid cystic carcinoma. After ko maoperahan, nag-take ako ng Simply Nature PPARS at noon po ako lumakas. Napabilis ang aking paggaling. Kilos ako ng kilos. Nakakalimutan ko na may sakit pala ako o naoperahan ako. Kaya sa Simply PPARS, lumakas ang katawan ko at napabilis yung paggaling ko. And I trust Simply Nature.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Boost your health today with Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Experience this dynamic duo now. Available on Shopee, Lazada, and our website www.simplynature.asia and our office here in BGC. Grab yours today!
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.
And welcome to another enlightening episode of Simply Nature webinar. This program is brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Just to recap on our last week's topic, we discussed the managing cervical cancer, empowering our patients through treatments. Lots of questions were asked and most importantly, answered by our experts. Today, we will welcome the first part of our webinar series, Many Phases of Breast Cancer. Today, we'll dive into the journey of those battling HER2 positive and HER2 negative breast cancers, two forms of disease that touch positive through once more aggressive, now offers hope and thanks to the targeted treatment. While HER2 negative continues to be a challenge with many of its complexities. In this fight for survival, we'll also discuss how new therapies like Simply Nature PPARS can be included and as a glimmer of hope by strengthening the body's defenses and opening new doors for healing. We extend our sincere gratitude for each one of you for tuning into this webinar and for encouraging others to join us tonight. Please do share this event to your friends and loved ones who will benefit in the insights shared. Now, without further ado, let's dive right in. Please note that we will be having what we call AMA or Ask Me Anything portion. So please feel free to drop your questions in the comment section. In yes, kahit po Tagalog, pwede. Now, leading our discussions tonight are distinguished health experts. First off, I'd like to introduce a successful entrepreneur who is a seasoned international speaker on a wide range of topics from personal success to healthcare. He is also the CEO and founding director of Simply Nature International, Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Sheila, and good evening to all our viewers. And I see people already asking questions. So we'll get to your questions after this short discussion of breast cancer. And this is Breast Cancer Month. And we're going to start off this series with some details about different types of breast cancer. So, all right, I'll hand the time back to Sheila. I'll see you guys. I think tonight's discussion is really short, so less than 10 minutes. We'll start answering your questions in less than 10 minutes.
Thank you, Sir Shyan. All right, now on to our next health expert. It's an honor to present an esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomat of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center, Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Please join me in welcoming Dr. Jansen Kalalan. Let's all watch this.
Hello everyone, we have a very special segment for you today. Actually, this lecture has two parts and both lectures would be about breast cancer. So for this segment, for the first part, we're going to talk about the difference between HER2 positive and HER2 negative breast cancer. Is it just positivity or negativity when it comes to these to HER2 status, or is there something more to it? No? So now let's talk about the difference between HER2 positive and HER2 negative. But before we go into more details, let's first define what HER2 is. HER2 means human epidermal growth factor receptor 2. Okay? So this is a unique receptor found in certain cancers like breast cancer, stomach cancer, and ovarian cancer. Okay? HER2 is more important in breast cancer. Why? It's because if you are HER2 positive, there is a medication that we can actually use to target these types of breast cancer cells and to eradicate them. The medication is your trastuzumab. So how do we know your HER2 status? Your HER2 status can only be determined from a sample of the breast cancer. So meaning, a breast tissue sample must be taken from the tumor itself. It's by way of core needle biopsy or by way of surgery or mastectomy. We take out the entire tumor and send it to the laboratory for testing. In the laboratory, they would look at the breast tissue sample under the microscope, no? and determine, do some stainings, no, immunohistochemical staining to be exact, to know the HER2 status of a patient. Now, the problem here is this test is qualitative. So meaning, in your test result, no, the result will just come out +3, +2, +1, 0. Okay? So this can be quite subjective because of the staining, because of how the test is being done. So sometimes if the test comes out as equivocal, so meaning there are cells that stained with the stain, no, that they use to determine HER2 status. However, there are also parts of the sample wherein there was no staining. So additional tests must be done to determine this, which is your FISH. FISH means fluorescence in situ hybridization. FISH is now a quantitative test that would be able to count the cells one by one and see if the number of cells is significant enough, no, to determine positivity of HER2 status or negativity. If you are HER2 positive, we actually have a medication which is also known as your trastuzumab to use, no, to try and cure the cancer, try to cure you. For HER2 status patients, why is this very important? It's because if you are HER2 status, the characteristic of the cancer is quite aggressive. Okay? And with the development of this new medication, the prognosis of HER2 status patients have gone up quite significantly. So what if you are HER2 negative? Then this means that trastuzumab treatment cannot be used for you. Then other medications would have to be considered as a treatment modality. Typically, the other receptor statuses have to be considered, specifically your estrogen receptor and your progesterone receptor. If they are positive, then hormone therapy can be used. If these are negative, so meaning you are a triple negative breast cancer, then only chemotherapy can be used, no, as a conventional cancer treatment method. If you are triple negative breast cancer, then the cancer is also quite aggressive and the prognosis is not that great because the treatment options are quite limited. So regardless if you have HER2 positive or HER2 negative breast cancer, there would be treatments that you would have to undergo. And one of these treatments, of course, would be your chemotherapy, targeted therapy like your trastuzumab treatment. Both treatments have side effects. And one of the side effects is, of course, your immune system going down. So how do we mitigate this side effect? I am using this supplement that I came across with that have been quite helpful for my patients, which is Simply Nature PPARS. So how does Simply Nature PPARS help patients who are undergoing these kinds of treatments? It's by activating their genes, no? It's by giving them the necessary antioxidant support that they need to help combat inflammation and thereby help combat fatigue, which is the most common reason why cancer patients actually decide not to continue on with their treatment. Another one is the immune system, no? It usually goes down, especially if the patient is undergoing chemotherapy. And Simply Nature PPARS can help activate the immune cells, no? It can help activate the genes necessary to create more white blood cells and to help activate natural killer cells to help combat cancer itself and to help combat infection. So that ends our discussion on HER2 positive breast cancer. If you have questions, let's ask them in the AMA segment.
Now, I'm so sure that you have learned so much from that discussion. For those of you who just came in, please know that you are watching what we call the Simply Healed webinar. Now, at this point, all right, just before we go to our questions for tonight, I'd like to greet our avid viewers. All right, starting up with Miss Mavs Avot, or Agot. Good evening po. Miss Rochelle Esternon, good evening. Thank you for watching. Miss Flordelina Cura, Joy Cabrera, and Kians Abanales. Also, Miss Edna Abello, thank you for watching once again. And Miss Imelda orasyon. Also, I'd like to please give a shout out to all our teachers out there. Happy Teachers Day to all of you. Thank you for being a huge part of our learning journey. All right, now at this point, let's not keep you waiting. I can see questions are coming in. Know that in this modern world filled with noise and different opinions, trust the ones from the experts. And now, to answer our questions for tonight, I'd like to call on once again our CEO of Simply Nature, Mr. Shyan Lim, and our lifestyle medicine doctor, Dr. Jansen Kalalan. Good evening, Sir Shyan, and good evening, Dr. Jansen.
Good evening, Ciela. Good evening, Doc.
Hello, hello. I was just arriving from my home no, a few minutes ago, so I was driving. Thank goodness I arrived just on time.
You look energetic and smiling today. Was it a good day today, Doc?
Yeah, it was. It was. Mm.
Oh, wonderful. So with Doc in a good mood, I think you'll get wonderful answers today. So Sheila, let's go to the AMA.
Let's start. All right, so for the first question coming from Ms. Rochelle Esternon, what is the difference of the chemo and ozone therapy? Both this therapy can cure breast cancer. Which therapy? Is it the chemo or ozone is better to take?
Yeah, very good question. Okay. Chemotherapy can reduce tumor size. You can actually go into remission with chemotherapy. There are a lot of patients who are able to do so. Chemotherapy, as all of you know, this is a type of treatment, cancer treatment that kills cancer cells. No, so chemotherapy can shrink tumors. Okay. On the other hand, ozone therapy is a therapy, no, wherein we're giving ozone to the patient. So ozone is a gas. So ozone is O3. That's the molecular name, no, for ozone. Now, what happens is when you receive this, you basically get three main benefits, no? Immunomodulatory effects, antioxidant, and germicidal. Okay? This cannot kill cancer cells, unfortunately, no? However, ozone therapy can enhance the effect of chemotherapy. It can reduce chemo resistance. So in other words, it can make a person more sensitive to chemotherapy. No, so in more simpler terms, no, more cancer cells will be killed with chemotherapy plus ozone therapy. Okay, ozone therapy cannot be used alone to treat cancer. It has to be used in conjunction with other treatment modalities.
There you go, right? It's always very interesting. There's always new developments in cancer therapy. Doc, there was a time where cryotherapy, are you familiar with that?
Yes.
Yeah, that's where they actually inject a cold and try and freeze the cancer tumor, right?
Yeah. Cryotherapy actually nowadays they use extremes of temperature. They use cryotherapy and hyperthermia. Cryotherapy, as you have mentioned, no, cryotherapy is wherein you freeze the tumor, then you excise it. Okay, so that's basic. So what the main reason why we freeze the tumor is to prevent cancer cells from getting out of the tumor. So you freeze the area, then you excise. So that's
interesting. Yeah, because then nothing will be moving then. All the blood and the blood vessels, everything will be frozen.
Yeah,
right?
everything will be freeze. Correct. So on the other hand, hyperthermia is where you use extreme heats, no, to burn. So yeah, it's really burning the tumor. So there are a lot of different kinds of hyperthermia treatments. So one is radio frequency ablation. That's literally poking a probe inside the tumor and then burning it. So we use radio frequency ablation for liver cancer, small liver cancer tumors, no? The more advanced one, no, not advanced, the more recent one is there is a machine that applies hyperthermia, but only to a localized area of the body. But this is bigger compared to RFA or microwave ablation, because for microwave ablation you can only burn very small tumors like 1 centimeter, 2 centimeter tumors. But for hyperthermia, it's like radiotherapy wherein it's localized. However, um, the target area is bigger. Yeah, so that's hyperthermia. Hyperthermia, some proponents of this treatment modality are even increasing the core body temperature. So they
Oh,
use whole body hyperthermia. So they increase the core body temperature up to 43 degrees, 45 degrees Celsius. So that's like a high grade fever. So the idea is to activate the heat shock proteins to kill the cancer. There was one conference that I attended. This conference was actually a lecture from, if I'm not mistaken, Malaysia.
okay.
The attending doctor, I'm not sure. He's either Malaysian or Singaporean. One of those nationalities. So they had this stage 4 pancreatic cancer patient wherein they used hyperthermia. The patient actually went into remission.
Oh, wow.
Stage 4 pancreatic. So everyone was amazed, but hey, the evidence is in our face. I mean, they had all the high-tech modalities, no imaging modalities, PET-CT scan. Yeah, the tumor went away. But of course, no, they did not use hyperthermia alone. They had they use other treatment modalities. No, actually a lot of different treatment modalities inside their protocol. So here's one very promising modality which I hope everyone would take note of. The cancer treatment modalities right now nowadays and in the near future, no, at least for the next decade, is really very promising.
Wow. So, despite all that, Doc, I mean, just from your experience, it seems like there are. I also noticed that I remember talking to Dr. Jimmy because he said immunotherapy, all these are very promising, but one of the challenges is very costly, very expensive. So, to many of our listeners out there, chemotherapy is still something relatively affordable. Uh, and when I was in Davao, I learned that in Davao, a lot of chemotherapy drugs are actually free for the less fortunate. So, so this is one thing that for our audience, well, keep your options open. Because I think one encouraging thing is chemotherapy over the years have been improving. And with the PPAR protocol, you can, what's that called? You can mitigate or you can lower all the side effects. But these other modalities are always very, very interesting. And hopefully, as it becomes more practice, the cost will come down and then it will become more available to everyone around. Yeah, it's always a very expensive thing, cancer. Yeah.
I totally agree. Most of the concerns is really with the budget, but that is really interesting, Dr. Lance. Thank you for
Yeah,
sharing.
we never know. In the near future, some of these procedures might be subsidized and recognized as part of the conventional site. So we just keep updated, right? But if you want to know of the more other options, please have a consult with Dr. Jansen. All right, he's actually able to guide you through the other option modalities that we've just discussed. Yeah, just like the cryo. You know, the cryo one was really the one I heard it from China. I think the Chinese surgeons were
Yes.
pushing, really introducing
Yes.
right? Yeah.
Yes. Okay. Since this topic came up, I just want to let you guys know. There are 2 hospitals in China. They have an office here in the Philippines in the
In
state.
Centuria,
Um,
is it? I know the
I'm
first
not sure. I'm
one
not sure.
visited was in Centuria. Yeah.
I'm not sure. I'm not sure. But there are. I know of 3 hospitals in China that does this. No? So one is
Yes, Fudo,
Fudo
that's the one.
University.
Yeah.
Fudo, yes. It's not Fudo. That part who partnered with me, no. But it was Stamford Hospital and Royal Lee Hospital. So both hospitals are in Guangzhou. They
Okay,
use
so if you want to explore that,
cryoablation.
yeah, if you want to explore that, just have a consult with Dr. Jansen.
Yeah.
All right, let's
Yeah.
go to another question. Well, before
Well, we are starting off really encouraging, I must say.
interesting. Something new.
All right, now for the next question coming from Ms. Noemi Veras. Good evening po to all. Breast cancer HER2 positive stage 4. I finished chemo, targeted therapy for 36 sessions of trastuzumab. Now MRI results, 4 lesions in the brain, radiation to be done this October 7. Consume 18 jars of PPARS powder already. What would you recommend about the dosing of PPARS this time?
Doc, before you say anything, I just wanted to say, for our viewer who has gone through so many sessions and so many dosages of chemotherapy, I'm just glad that she has been on PPARS 18 jars. So that means 1.5 years around there, right? So she's still strong, still going on, still able to continue her protocols. And this is what we have been always talking about, right? That PPARS can support you through the negative side effects of your chemo sessions and immunotherapy sessions, right? So this is wonderful. So Doc, now that she's going for another procedure, what would your recommendation be?
Yeah, it actually depends on how you feel in general. Yeah, depends on how you feel, no? However, if we only just consider the procedure that's going to be done, no? Is the radiation therapy stereotactic radiosurgery? Meaning if you're going to undergo stereotactic radiosurgery, this is going to be it's going to be one session radiation therapy, but a very high dose. So expect after this procedure, your body will really be down. Okay. So if it's SRS that you're going to undergo, then PPARS liquid is the one that you have to take, no? But you just buy 1 box. After you finish the 10 vials, you'll be fine. Okay. However, if the radiation therapy that's going to be done is a longer one, no, multiple sessions, longer period, then I would still recommend PPARS powder. Yeah. Then from PPARS powder, we'll see, no, how you respond to the radiation therapy, what the side effects are with PPARS powder. Then from there we can shift to if you're really okay, we can then you can just continue. If it's still lacking, then we can consider going up to PPARS liquid. Yeah.
So,
okay, so
again,
yeah.
Just to summarize what Dr. Jansen has said, if you are one session, means you're going to go for the high dosage, high intensity one. So that one, Dr. Jansen recommends the liquid, and I also agree with him, because if it's going to be high intensity, your body's going to really feel it. You want to recover and balance it out as quickly as possible. If it's multiple sessions that you're going for, then the powder would be fine. However, if at any point you start to feel yourself feeling very weak or adversely affected by the procedure, you can always just put your powder aside, keep it in the fridge, right? Get the liquid, you'll finish it in 10 days, and then you can go back to the powder. This is to help you rehabilitate and recover as quickly as possible. So did I get the summary correct, Doc?
Yes, absolutely correct.
All right. Thank you for the clear direction, Doc.
I just want to quickly, you might want to also consider, like, if you are experiencing any dryness in your skin since you are doing the radiation, you might want to consider the AD Pro as well. Right.
Yes.
Okay. All right. So for the next question coming from Miss Tien's Abanales, how to cure lung nodules?
Oh, that's an interesting one.
Lung nodules can be anything. Okay, it can be because of an infection, it can be because of cancer, it can be also benign, no? So we have to know which of these, no, is the reason of the lung nodule. Actually, if sometimes, no, we don't actually do anything with lung nodules. We just monitor. Okay, some don't even need any treatment at all. Okay, so yeah, we need to know these things, no, before I can make a definitive answer. So I think it would be better if you go for a consult, so we know, no, how to go about this.
Yeah, I just want to reiterate, any advice that we give on the program is basically just a reference to a standard medical condition similar to what you have detailed. So it cannot be a personal advice when it comes to your treatment protocol. So always for cases like this, it's so hard. Doc cannot do a proper diagnosis like that. He has to have a proper interaction with you. And it would, you will be surprised, even though it's a Zoom, even if it's teleconsulting, even a Zoom call, looking at your facial color, the way you speak, the strength, and all of that, that will also help Doc Jansen or any physician make a proper and more accurate diagnosis. All right. So yeah, good news is you don't have to queue up and travel all the way to wherever Doc Jansen is. Just type it in. We can arrange for a teleconsult. Which would always be I always actually advise a good teleconsult. Why? Because Philippines is such a large country. You want to get the best doctor that you can, and the best doctor for you might not be the one that is nearest to you. So you can wherever you are in Philippines, or anywhere in the world, you can consult with Dr. Jansen.
Once again, for those of you who wish to have a consult with Dr. Jansen, the link is in the description box, or you can just simply type in how to consult. Our PTHTS will definitely get in touch with you individually. All right. So for the next question coming from Ms. Natalie Dolores, thrown to us privately. She's from Tagum City. Hello po. In what specific age women can do their self-breast exam?
Oh.
Once you already have full-grown breasts, then it would be wise to have. So if you want a specific age, I think as young as 18 years old, you have to teach your kids already, how to do it properly. So mothers, take note of this age. Yeah.
But how about Doc? Those people history of breast cancer in the family. What would be the best age to start checking?
Still the same. Still the same. 18 years old. You have to know how to do it. So everyone, all women. Okay.
All right.
Yeah.
Okay. All right. So for the next question coming from Ms. Christine from Quezon City, what is easier to treat? Is it the triple negative or the triple positive?
Easily triple positive is easier to treat. So just for everyone's idea, no. So what's triple negative, triple positive?
Yeah,
so this is
what's that?
this is a subtype of breast cancer, no, depending on immunohistochemical staining. Now, what does the triple negative, triple positive mean? No? So these are three parameters. So you have your estrogen receptor, progesterone receptor, and HER2 status. So for triple negative, meaning the tumor is negative for estrogen receptor, progesterone, and HER2 receptor. No, and why are these receptors important? Because these receptors will determine the treatment. Okay, there are medications that targets these receptors. No, the goal is to kill the cancer cells or to stop them from spreading. So that's the idea. So if it's triple negative, then you cannot actually use any of the medications. The only medication that might work for you is chemotherapy. Then that's it. No? For triple positive, then the tumor, the breast cancer cells have estrogen receptor, progesterone receptor, and HER2 positive. So if you are estrogen receptor and progesterone receptor positive, then hormone therapy can be used. No, so for HER2 positive, then trastuzumab can be used. So this is targeted therapy already. All right? So this is what it means. Of course, if you are triple positive, then you have more treatment options available to you. If you're triple negative, then treatment options are limited. So this is the reason why it's easier to treat triple positive compared to triple negative.
All right. No, thank you so much, Doc Jansen. I have here a very interesting question thrown to us privately. Okay, I will not say the name. Okay, so the question is, it's breast related but not cancer related. Feeding my baby, and then the milk suddenly is gone. Is it possible for the milk to come back again or to return?
Oh, that's
I believe so. I believe so. I believe so. You just have to allow time for the breast lobules to secrete more milk. There are also foods, no, that you can eat to so you can produce more milk. One such food is malunggay. I remember one of my classmates back in med school. She's now a pediatrician, and I remember she mentioned they are advocating malunggay, no, for breastfeeding moms. So that's one option. Of course, hydration is also very important. If you are dehydrated, then expect less breast milk available. If you are stressed, breast milk, stress also can affect the amount of breast milk that you can produce. So these factors you have to take note of.
I couldn't agree more.
I also wanted to share, many years ago, this is like maybe, wow, possibly 20 years ago. Okay. I met up with like this is a integrative, okay, this one is a naturopathic, I think it's a naturopathic doctor, not a MD. But anyway, the naturopathic doctor was telling me he was prescribing PPAR tablets, just the tablets, to a mother that had problem lactating. So I was very curious because there is no specific mechanism of action that I knew of that for breast feeding mother taking PPAR tablets will actually help with the lactation. So I asked him why. He said because of the calcium content in our PPAR tablets. So I said to him, oh, we have very healthy calcium content, but it's not like the same dosage of a calcium supplement, right? A calcium pill. So he said, no, the difference is that your calcium is actually chelated in plant form, whereas whereas when you buy a calcium supplement, it's a calcium concentrate supplement. It's like malunggay. I'm sure malunggay inside also contains calcium, right? The natural malunggay. So Doc, is that for proper lactation? I just was wondering.
Yeah, it's a good question.
Very interesting question. I believe so. I believe so. Yes, no.
Oh, okay.
But it's not just calcium. For human breast milk, if you notice, if you try to analyze the content, no,
Yes.
the calcium is not that high. It's actually rich in protein.
Oh wow. Okay.
Yeah, the calcium is not that high. Yeah, but definitely you will need calcium. That's why ladies who are pregnant, their OBs always advise them to take in calcium supplements, no? So this will
there is a correlation. All right.
Yeah, there is a correlation. So this will aid breast milk production so that the minerals necessary or the minerals required to be present in the breast milk would be there, no? Yeah.
So for this particular viewer who asked this question, then now I will really do a plug-in, right? I will say I will really encourage you to take PPAP tablets instead of like a calcium supplement. The reason here is very simple. It's just like it's better to take malunggay than an extract of malunggay, because in the natural malunggay you have all these rich in vitamins and different minerals. And you have these things called phytonutrients, which are plant-specific nutrients. So there's just so much benefits that you can get by taking microalgae, like PPAR tablets, and then you will also get the calcium that you need, but you get all the other effects, right? And PPAR tablets have already been proven that's effective for diabetes. So just in case, pregnancy, that will also help you normalize back, right? It reduces inflammation, chronic inflammation. So that's going to be good for your recovery from the entire pregnancy process. And in the Chinese TCM approach, when a lady gives birth, right, they lose a lot of blood. That is good and bad. Good because a lot of toxins and also come out together with it. So it has like a renewal kind of benefit, right? A lot of the blood that has been circulating in your body for the past like 18, 20 over years is suddenly withdrawn, and then your body's going to produce new ones, right? So on the upside, on the side that you need to take note, because the body also needs to replace a lot of blood. Usually after pregnancy, the Chinese have a tradition of the first month after pregnancy, they eat foods that are very rich in nutrients, very nourishing to help the mother. You know, in Philippines, there isn't this tradition. However, and most people give birth and after that, they're fine. However, the benefits are not seen when you're young. The benefits are seen when you're very, very old, all right, like in your elderly years. Because then whatever you have preserved and nourished back your health when you were giving birth, you won't have the side effects that come in your later years. So just some different perspective from a different culture. But I would really advise, if you're looking to take like mineral supplements like calcium, take PPAR tablets instead, because you're going to get so much more. Yeah.
Exactly. All right. Well, thank you. Yeah, I remember when I was also breastfeeding, I was always eating dishes with malunggay, like every time. So there. Thank you so much, Dr. Jansen, Sir Sean. Next question coming from Ms. Jan Chang Ang. Can PPARS tablets regulate blood pressure, low BP to normal, and high BP to normal as well? Thank you.
Not directly. I wouldn't say absolutely yes, no. Not directly. One of the reasons why a person can be hypertensive is inflammation. PPARs have a lot of anti-inflammatory nutrients, no? A lot of antioxidants that can help this. Hypertension is more than just inflammation, no? It can be because of blockages, it can be because of your heart, no? If your heart rate is elevated, stress as well. So it's multifactorial. Yeah, it's really multifactorial. So just saying that PPARs can lower blood pressure right then and there would not be totally accurate, but it can help. Okay, it can help. Um, Definitely, it can help preventing hypertension, the existing hypertension from getting worse. No, at least you can expect that much. But of course, can PPARs substitute medications that lower blood pressure? Of course not. No, of course not. You still have to pinpoint the root cause of the hypertension and then address that. So, do the antihypertensive medications do they address the root cause? Not really. Not really. Yeah, the antihypertensive medications that you can buy from the drugstores, like your losartan, your amlodipines, no, your beta blockers, they don't. Okay. Antihypertensive medications lower blood pressure. They either prevent the blood vessels from constricting. They can also maintain the dilatation of your blood vessels. So the blood vessels the diameter of the blood vessels will remain big. So by doing so, it can gradually reduce your blood pressure. Okay? That's one. Another one is to prevent the yeah the flow of the blood, no. Try to prevent it from going too fast, or just tone it down a little. So that's your beta blockers. The first one that I've mentioned, that's losartan, and that's your ACE inhibitors, your sacubitril, your perindopril, yan, okay? Those are your ACE inhibitors from constricting. That's also your calcium channel blockers, or like your amlodipine, all right? Another one is to lower the volume inside the blood vessel. That's also one way to lower blood pressure. So like that would be your diuretics. Okay? So these medications don't address the root cause. They are very effective. Why? Because they act on the physics of the blood vessels. Yeah, the fluid dynamics. of your blood. Okay, so they active. However, if you notice, like I think majority of you, no, if you are on antihypertensive meds, if everything remains the same, no, you don't do anything with your lifestyle, eventually these antihypertensive medications will increase in dose, and there will come a time that you will have to take another one, a different one. All right, so that's the thing. No? They don't address the root cause. So they only address the tip of the iceberg. That's why, although they are quite effective in addressing a short-term increase in blood pressures, but however, long term, no, they won't be that effective unless really there is a fundamental change inside your body. Okay. Yeah.
Yep. So there again, just to confirm, hypertension has so many causes you won't know. However, it is a good guess or a good approach because in general, again, because we are talking to you without having a consultation, that hypertension is always linked to the chronic illnesses of most modern city dwellers, which is diabetes and high blood cholesterol. Right, so all these are like partners in crime, right? So one thing good is that if you have hypertension, do take a look at your blood sugar. You might be borderline diabetic. You probably have increased high blood cholesterol as well. Those are part and parcel because the lifestyle that makes you hypertensive will probably also give you high blood cholesterol and high blood sugar, right? Because when we are stressed, we eat junk food and all that. So it's all kind of linked. So because of that, starting on PPAR tablets is a good way, because if it doesn't solve your hypertension, but you are borderline blood sugar and blood cholesterol, then it will actually normalize your blood sugar and blood cholesterol. So there are many benefits to that. Yeah. Thank you.
Thank you, Sir Shyan. Okay. Next question coming from Miss Annabelle Knoll. Good evening po. Can I have a question about when it happened to have a wound in outside skin of lump, how to treat it? Okay, so she has a wound outside the skin of her lump. Now, how will she treat it?
Okay, very difficult, no? If the lump is indeed breast cancer, the ulceration will eat away, the tumor will eat away the skin. We can only slow down the progression. However, as long as the tumor is there, as long as the cancer is there, it will eat away the skin. So there are a few treatment modalities that you can use to address the wound itself and to attempt to try to dry up the wound, no? So one is ozone therapy. So we can do breast ozone funneling. It does a wonderful it does a wonderful effect on the breast wound. So the breast wound dries up, and you can see granulation tissue on it. So meaning these granulation tissues are tissues these are healthy tissues that's trying to heal the wound. Okay, so ozone therapy, when it comes to wound care, initially is mainly done on burn wounds, diabetic wound, non-healing wounds because of diabetes, because of peripheral artery disease. Now, when it comes to these diseases that I have mentioned, the main issue here is lack of oxygenation or infection itself. Very different from a wound caused by cancer, because the cancer is the one that is eating away the skin, eating away the tissues around it. So when it comes to this, if the wound is becoming very difficult to achieve a complete healing of the skin, no? For the other disease like your diabetic wound ulcers, like your peripheral artery disease, you can actually get a normal skin out of something that's seemingly untreatable already. Yeah. Okay. Another treatment modality that can for ulcerations because of cancer is hyperbaric oxygen therapy. However, here's the thing, no? If you're going to use hyperbaric oxygen therapy, then some treatment modality has to come after. Okay, why? Because hyperbaric oxygen can induce angiogenesis, formation of new blood vessels. Okay, so cancers form new blood vessels. So this is one caveat that you have to take note of. So hyperbaric oxygen alone cannot be used to treat wounds because of cancer, because of breast cancer. However, hyperbaric oxygen therapy can be used as an adjunct for other treatment modalities for cancer, like your radiation therapy. Another one is high-dose vitamin therapy. So these three treatment modalities work best when the amount of oxygen that is present in the blood or in the body of the patient is very, very high. Okay, so that's one, no. Another treatment that you can consider is, of course, surgery. Have it removed, have the breast removed together with the wound. Yeah. Okay.
Just a follow-up question, Doc. So even if the wound is still fresh, you can do surgery with it?
It depends, no. If it looks like it's infected, if the body of the patient it appears that there is infection, then you cannot do surgery. You have to treat the infection first, no. However, I have seen patients wherein there is already a big lump, no, and it's already beginning to ulcerate. So there's a non-healing wound already with discharge. The surgeons actually went on to remove the entire breast, no. I think it depends on how bad the ulceration is and how deep the ulcer is, no. Yeah, if the wound is still relatively superficial, then you can actually remove the entire breast, no. However, for very deep ulcerations, then the surgeons won't touch it because more often than not, with very deep ulcerations, the cancer would have invaded the bones, the muscles already, the chest wall basically. So if it is such, no, then you cannot do surgery anymore.
So for such case, Doc, just very quick question. For such cases that they cannot also do the surgery, they have to proceed immediately with the chemotherapy, correct?
Yes. However, not always, no. If the patient is infected, no, the amount of infection inside the body of the patient is very high, then you cannot proceed with the chemotherapy. You have to treat the infection first, then go for the chemo. I have encountered a few patients wherein they already have breast ulcerations, no. They underwent chemotherapy, the wound dried up.
Oh,
There are such patients.
thank you. Sir Sean, would you like to add anything?
No, I'm good.
All right. Okay, so thank you, Dr. Jansen. Thank you, Sir Sean. Let's go to the next question coming from Ms. 8MB. Good evening po. I'm a breast cancer stage 2A, HER2 positive, done with my 18 cycles of trastuzumab, Herceptin. Amnesia after my targeted therapy. I was given trimetazidine 2 times a day and half of 50 milligrams of Lazada, a serious condition of the heart. Thank you and God bless.
Yeah, I won't say that it is serious. How serious it is entirely depends on the symptoms and the ejection fraction, no, of the heart. So hypokinesia is just that the contraction of the heart muscle is not that good. Yeah, so that's what it means, no. In simpler terms, it's sluggish. So sometimes, no, patients can develop hypokinesia and still have relatively good ejection fractions. Then, it's not going down. However, hypokinesia will be very serious if the ejection fraction goes below 40, and that is bad. Okay, so can we do anything to reverse the hypokinesia? In theory, there is. You have to mimic hypertension. That's the idea. Well, that is in just my hypothesis, no? It's just my hypothesis. Because for patients who are hypertensive, they have thickening of the heart. With hypokinesia, the heart muscles sometimes thins out. they are not contracting that well, no? So in order to treat this, exercise is a must. Physical activity. Yeah. I just don't know if stem cell therapy can be done on this. However, the problem here is you are diagnosed with breast cancer. So stem cell therapy cannot be administered on cancer patients. No, the only time that stem cell therapy can be considered for cancer patients is when your circulating tumor cells are insignificant. That's the only time. Okay, that's the only time. No.
Well,
Yeah.
in general, because this is a very interesting statement that you made, because I remember in Singapore there was a time where, how shall we say, there was a network marketing company, I think, and it was selling deer placenta, if I'm not wrong, and they were doing very well. And the idea that they was telling people is, placenta is like stem cells, right? So why would it be why would a person need to be careful if they have cancer to use anything with the concept of a stem cell?
Yeah. So stem cells are cells that if they attach to the nearby cells, no, they will become it.
Oh yeah, so
Okay,
that
so
means
there's
like a replication. They are easy to
yes,
duplicate cells.
yes. So just imagine um yeah, I just use the student metaphor. So
Yeah.
imagine stem cells like students. So students are immature. They once they graduate, that's the time that they choose whatever they want to do in life, no? So that's like specializing. So it's the same with cells, no? Immature cells are stem cells. So they would, yeah, they undergo maturation and become the adult cells that we know of, like your skin cells, hair cells, bone cells, lung cells, colon cells, no, etc. Yeah, so they undergo this maturation. So when we use stem cells usually go to places where there is inflammation. Okay, so say for example, no, you can use stem cells for stroke patients, or patients who have osteoarthritis. So for let's just use osteoarthritis. Okay, so you have your joint cells, no, cells found inside your joints. So they are damaged. Okay, so when you give stem cells to this person, the stem cells will home to the arthritis. They attach the cartilages there. The stem cells become the cartilage. In other words.
Yeah.
Yeah.
All right.
So imagine yourself, you have cancer. So patients who have cancer, the inflammatory markers are very, very high. So where there is tumors, there is inflammation. So when these patients receive stem cells, the stem cells will home into the tumor. Then the stem cells will attach to the tumor. And yes, they will become the cancer cells themselves. So this is possible because even without administering stem cells, we have such a thing called cancer stem cells. So cancer stem cells are stem cells wherein they produce more cancer cells. Okay?
So
this is
again, yeah, I mean, sometimes in direct marketing and network marketing, they like to use words that sound very cutting edge. And stem cells are not something new, all right, but it's something actually very sensitive and very regulated in many countries, actually, for many reasons. Number one is, how do you get stem cells? Some ways of getting stem cells can be very unethical. So those are also considerations. So, but anyway, I think Dr. Jansen has given us very good thing. So I won't know exactly what things some people will look at, but at least now you have a basic understanding. Stem cells will zoom in on where there is inflammation. And of course, when you have cancer, the cancer tumor around there will be inflammation. And it's like a mirror, right? It's like a mirror that once it connects, it will mirror whatever it connects to and help the thing duplicate. So that's not what you want to do. You don't want to duplicate cancer cells in your body. All right, so just something for you to take note of. I'm not making any comments about any specific products, but I just thought this was an interesting question that Dr. Jansen brought up because he said cancer patients should not take stem cell products. So at least now you understand the mechanism that Dr. Jansen is talking about. Yeah, thank you, Doc. I learned something today. We always learn that Thursday is our education day. Yeah.
I think we all did. Thank you, Dr. Jansen. All right, next question coming from Miss Christine Banol. Good evening. I'm a breast cancer stage 2 kidney disease as well as polycystic liver disease. What is the best diet for me? Thank you.
Okay. For you, it would be a vegetarian diet. For all cancer patients, the default diet is a vegetarian diet, no? And since you have polycystic kidney disease, if your creatinine is high, well, the creatinine being high doesn't have it doesn't have anything to do with the kidneys being inflamed, no? It has everything to do with you having a polycystic kidney. So to reduce in order for the creatinine not to spike up, you have to reduce the load on the kidneys. So animal protein increases the load on the kidneys. Plant-based proteins, not so much. Actually, it's quite protective for the kidneys. So with this kind of condition, automatic, it's a plant-based diet, a whole food plant-based diet, without even considering the polycystic liver disease.
You know,
automatic.
I want to make a comment to everybody as something I observe in a normal diet thing about, is there a difference between animal protein and plant protein, right? So Doc, as you mentioned, I just remembered. Doc, correct me if I'm wrong. If your urine bubbles, I wouldn't say like bubbles more than usual, or slightly foamy, right? So basically, to all the ladies, I don't mean to be rude. I'm just trying to describe something. Right? So when you urine hard and it's very noisy, right? So obviously it creates like bubbles. Okay. So a normal urine, even though if you urine hard and it creates bubbles, the bubbles burst and disappear. So they don't stay. When you look in the toilet bowl, you don't see bubbles. But if you do, that is either possibly high blood sugar or high protein in your urine. Am I correct?
Yes, more on high protein.
Yeah.
It's really high protein. If you have sugar in the urine, you'll have protein already.
Yeah, okay, so here is the thing, guys. I just wanted to share. Recently I just had my birthday. I was in Boracay with my brother-in-law, and he was really nice. Gang's steakhouse. All right, and we had a beautiful, huge, but very beautiful and very delicious ribeye steak. So that's all we ate. All right, it's just the steak and that's all, bread that came before the dinner and wine, right? So when I went back to my hotel in Boracay, when I peed, right, I noticed slight bubbling because there was a lot more protein than I normally take. Okay, so I straight away knew, okay, tomorrow, no more meat. I'll just take vegetables. So now I'm gonna share something else with everyone. I love homemade bean curd when I go to my favorite restaurant in Putian, so I can eat a whole big plate of it, right? Bean curd is like 40% protein in mass, so it's very high protein plant food, right? I never have my urine bubble after I eat a lot of bean curd, but I actually see my urine bubble if I eat a huge piece of steak. So is there a difference between animal protein and plant protein and its stress on your kidneys? Here is a very simple example for me, right? So when I take a huge protein meal, I like steak, I actually see my urine bubble a little bit, right? But when I eat lots of bean curd, nothing like that happens, right? Doc, sorry to interrupt, but I just noticed and thought of that. Wow, it's very different, plant and animal protein. Even in the effect on your urine, you can tell that it's not the same thing. Yeah.
Thank you, Sir Sean. Yeah, that's a very good point for most especially to those who are like on their way to possible CKDs. Like there. Okay, thank you, Sir Sean. Thank you, Doc Jansen. Let's try to answer. I think I can see two more questions
more.
here before we say goodbye.
Especially
Okay.
breast cancer oriented, right? It's breast cancer month, so let's try.
It is. Next question coming from Ms. Annabelle Noll. Doc, is it advisable po to have surgery if triple negative breast cancer finish chemotherapy and after that it begin to have a wound outside the skin?
Yeah, absolutely. If you are still a candidate for surgery, please do so. Please have the surgery, okay? Surgery is the single cancer treatment for cancer though, that can increase your survival, your overall survival significantly. So please have it done. Please have it done. I have said this many times, no? Many times, 100 episodes back. I'm going to say it now again. If the headquarters of the cancer is not there, the tumor burden, the tumor load immediately goes down. It's just the lymph nodes, the microscopic cancer cells that we have to address. And it's way easier to address microscopic cancer cells, no? Small areas of small locuses of cancer compared to one single lump of cancer. Okay? So, yeah, if you're still a candidate for surgery, please have it done, please.
I want to also reiterate what Dr. Jansen said, because there is a magic word that Dr. Jansen says. He says, if you are still a candidate. So for all of those who are thinking about surgery, please remember that just because you can do surgery today doesn't mean that option is available 1 month from now. Your condition can worsen, and then suddenly you can't operate on that cancer anymore. It has, for example, it has spread, right? Or sometimes even if surgery is a very high success rate, but because your tumor is in the difficult position, surgery becomes an option that is not available. So if your cancer is easily operable, it is in its early stages, it is one of the best options you can take. Right?
Question coming from Ms. Cherry Natividad. How about if you have cysts but not cancerous? Is placenta, can placenta duplicate this as well?
If there's inflammation, yes. If there's inflammation, yes. No. Although cyst is a little bit different because cysts are essentially masses that is liquid inside. In theory, it won't. In theory, it won't. However, again, if there is inflammation, no, it can. Okay. So on top of that, placentas have a lot of growth hormones inside, growth factors that can induce tumor growth. No, however, if it's a cyst, chances are it won't have any effect.
So, Doc, why would anyone want to take stem cells? What are the benefits that are touted? Why anti-aging, right? What rejuvenation of the skin? I think that's the
Come on.
Yeah, stem cells. Why do we have this technology available to us? It's mainly because of the degenerative diseases. Anti-aging aesthetic purposes came second. The degenerative diseases like Parkinson's, your stroke patients, patients who had a heart attack, diabetes, wherein the patient is already injecting insulin, the pancreas is not working that well already. Patients who are in the brink of getting liver cirrhosis, you're trying to save whatever's left of the
so you want
liver.
the liver to regenerate. You want the liver
Yes, you want to regenerate. You want to stimulate regeneration. Patients who are who have arthritis, very bad arthritis, no, especially osteoarthritis. So stem cells can be used for such patients. Yeah, stem cells can be used for such patients, and stem cells work wonderfully for these patients. This is one reason why stem cells are really talked about in medical conferences. This is one reason why there are a lot of clinics who offers stem cells, not just outpatient clinics, but also hospitals. Okay?
So stem cells, so stem cells have their place, but just as cancer patients, you don't want your cancer to grow rapidly. You want to regenerate your cancer. Yeah.
Yes. There is actually one Japanese company, no, who certifies doctors for administering stem cells. So one rule that they have is that you cannot give stem cells to cancer patients. They actually have a very extensive list of tests, no, to screen for cancer. So just imagine this.
Oh,
So
wow.
this is a legitimate this is a legitimate company in Japan that manufactures or processes or grows stem cells. Their main contraindication is cancer.
Yes. So to the original viewer who asked this question, stem cells for cancer treatment, I think today is a great day for you, because thank goodness you came to this program and you asked this question. And I think it has also blessed all the other viewers out there, because I think in general, if you're not in the medical industry, you have this perception that some stem cell is some miraculous high-tech cure-all, because it can make you young again. So you think if you become young again, you don't have cancer. Young people don't have cancer, right? So it's absolutely, Dr. Jansen has shared why, and then this example of a real stem cell company, and the one type of patient they will never use their products on is actually cancer patients. So to all our viewers out there, be very cautionary to even use any stem cell-like products for your treatment of cancer. Okay, thank you, Dr. Jansen. I think, and thank you for the original viewer who asked this question.
So, this will be our last question for today. Okay, so it's coming from Ms. Alma Aligada. Good evening po. What is the best treatment for adenocarcinoma?
What part of the body? You have adenocarcinoma. Okay, what does this mean, no? Adeno is gland. That's I think the Latin term gland. Carcinoma is cancer, no? So adenocarcinoma is basically cancer of the gland. There are a lot of glands found inside the human body. So what part? Adenocarcinomas can be from the colon, it can be from the head and neck, no, adenoid cystic carcinoma. So that's an adenocarcinoma as well. You have your lungs, adenocarcinoma. So what else? You have your breast, anything that's glandular. Pancreatic, the pancreas is also glandular. So what part? No, that's my next question. Now, if it is a solid tumor, no, adenocarcinomas usually become solid tumors, then the best treatment, or if I will choose only one treatment, I will choose surgery. I will choose surgery. Yeah. Again, if the tumor is not there, with early detection, surgery is almost curative. I think if Dr. JV is here, he will agree.
Yeah. Yeah.
So because you said it's curative, you know, so that is a very strong that's a very strong statement, something that I think everyone, if you are on the fence about it, give it great serious thought. If you're not sure and you need to talk more and ask more, there's two options, right? If you want set an appointment with Dr. Jansen, right? And then you can also explore what other cancer protocols that he can talk to you about. The next one would be you can talk to our friend, someone that we both know and trust, Dr. Jimmy Katapia. So he's in Manila Medical City. He's actually, I believe he's the head of the cancer center there. So he's an excellent surgeon and an excellent doctor and person, right? So he will be able to advise you. And just to assure you, during our last SMX Aura event, there were people who asked him, gave him their condition and asked him if they needed to do surgery. So he was actually able to tell one or two of them. No, in these cases, you don't have to do surgery. So it's not true that if you go to a surgeon, he will for sure ask you to do surgery. It's not true. So if you want to find a surgeon that you can trust, we recommend Dr. Jimmy Katapia.
All right. Well, thank you so much, Sir Shyan and Dr. Jansen. Of course, just before we say goodbye, I'd like to ask for a very quick parting words from the both of you. Know that this is the first part of the two parts of the many phases of breast cancer series that we are having this October, since it is the breast cancer awareness. Right? Who would like to start?
Doc?
Okay.
Yeah, go ahead, Doc.
Yeah, I just want to give you an idea, no, sa some of the things that I am exploring. Okay, so this Sunday I'm going to Taiwan to attend the Riordan Intravenous Vitamin C Academy. I'm sure there will be a lot of things that they're going to teach there, techniques, no, that they're doing in the US, in Japan. So yeah, next week I'm going to share some of those ideas to you in our next webinar. So those of you who are watching right now, stay tuned for next week. No, I hope I can see you again there. So yeah, so that would be it. No, thank you for attending, and thank you for asking these wonderful questions.
Thank you, Doc, and thank you, Doc, for continuing always traveling around the world to learn about more and new techniques about how to treat patients specifically in cancer and also in other areas. So my last word to every of our viewers here is, again, thank you for being with us for all these years, and for those who have been with us for a long time. For those who have just joined us, you can see that over the last 4 years, every Thursday we've been on, and we've been tackling subjects of cancer, and we've also introduced new understanding and new topics as well. So even our approaches to treating cancer, we have been answering questions from vitamin C drip to ozone therapy, to TCM, to today we even touched on hypothermia and cryosurgery. So this is a place where we discuss many options, and then we go back down to, we always discuss the tried and true ones, right? The ones that are still being used, widely accepted or universally accepted. So again, thank you everyone. We'll see you next Thursday on the second part of Breast Cancer Month's focus, which is the topic of breast cancer. So to everyone, have a good week ahead, and I'll hand the time back to Sheila. Thank you.
Thank you, Sir Shyan. Thank you, Dr. Jansen, for answering the questions of our viewers for tonight. And of course, we hope to see you once again next week, of course, in the next weeks to come to answer once again. All right. Now, at this point, I'd like to invite everybody for our next webinar. It is entitled Many Phases of Breast Cancer Part 2. It is it will be focusing on the triple positive and triple negative breast cancers. Okay, that's happening on October 10th. Another Thursday at 7:30 as well. So please have this shared to your fellow patients or loved ones who also are suffering with breast cancers and can relate to the discussion that we are sharing here in Simply Nature webinar. Now, another one, I'm very, very excited to invite everybody because we are featuring another Simply Nature's newest program. Okay, join us for the pilot episode of the Simply Nature Answers. Take advantage of our Ask Me Anything session with the founder of Simply Nature International and the PPARS expert from Singapore, Mr. Shyan Lim. Tune in. This is happening on October 16. That's a Wednesday at 4 p.m. So it is a chance for you to learn, ask questions, and get exclusive promos as well. So get ready to explore new insights into health and wellness with Simply Nature. All right. I also want to say thank you for those who joined the recent Sulit Sweldo sale, which wrapped up just yesterday. But the excitement isn't over yet. So please don't miss the much-awaited Simply Nature Mega Sale. This is happening starting October 9. That's the Mega Sale 10/10, but it's happening starting October 9 up until October 14. So be sure to check our participating products exclusively on our Laz Mall shop. Yes, we're very proud to say we are not just in Lazada, but we are in Laz Mall. So get ready for those incredible offers coming your way. Okay. All right. Well, once again, we are very, very thankful for you, for all of you who joined us tonight. Know that your victories over cancer is what keeps us going here in Simply Nature. Because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
Today with a Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS tablet for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Now is the best time to try our Simply Nature products. Available on our official Shopee, Lazada flagship store, our website www.simplynature.asia, and our office in BGC Taguig. Order yours today. Click the link on the description box.
These are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery, but prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.